Victoria City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
It's going to also cover other tropical diseases as well, so not just dengue fever. I had a friend a few weeks ago, we were supposed to have a meal together, he said, "Oh, I've got the flu." Right? 5 days later, "Oh, it's dengue fever." Right? And he lives in a house which tends to make you more vulnerable. But, of course, the good Dr. Hisham, down from Bangkok, he's going to really enlighten us about this and other diseases so important. He's come down from Bangkok today, from the Travel Clinic in Bangkok. It's attached to Mahidol University, and it's fantastic. The vaccines there are really reasonably priced, and they know their stuff. So not just about living in Thailand, but if you go somewhere else, perhaps Nepal or stuff, you want to research and get vaccines you might need for those countries. So, welcome, Dr. Hisham. Thank you so much for coming, giving this talk.
Thank you. Yeah, all right. Okay, my name is Hisham. Nice to see you all here. It's my second time here. And let me... That one? No. Okay. So I would like to thank everyone of you here because you participated in one of our studies here. We did among expatriates. We looked at within over 1 year, like how frequent do you get dengue fever. So these are all my collaborators, which helped me with the studies, which I will present here. And yeah, nothing to disclose. So this is the outline. I'll give a brief history about the history of dengue, the transmissions, the signs and symptoms, how you're going to prevent yourself. And I'll be talking about a little bit about the other tropical diseases like malaria, which you already know. Zika, chikungunya, these are also viral illnesses, diseases transmitted by mosquitoes. So like the Asian tiger mosquito here.
We have some people from southern USA here, and they hear more slowly than other people.
Sorry.
So if you can slow down a little bit.
All right. I'm sorry about that. So I was saying, the top, so malaria, Zika, and chikungunya. Oh, this is not working. These are viruses transmitted by mosquitoes. And rickettsia and leptospirosis, these are like bacterial infections which are transmitted by the rodent. And then at the bottom, that's melioidosis, right? So that's a bacteria which thrives in the soil. So if you get exposed to flash flooding or visit eastern part of Thailand, you might be at risk of getting melioidosis. There's a nickname for melioidosis. It's called the Vietnamese time bomb. So during the Vietnam War, the pilots flying the helicopters, they were exposed to the dust from the propellers. So several decades later, back in the US, they developed pneumonia, and they found out that it was Burkholderia pseudomallei, the bacteria which causes melioidosis. So they linked it to the time they spent in Vietnam. Okay, moving forward, so I have an example here. So we just had the Paris Olympics earlier this year. And there was like 16 million people visited the Olympics, which resulted in this. So they had several outbreaks of dengue in France. So what we're trying to, like, why did it happen? Why did France have so many dengue outbreaks and causing the hospitals to be overwhelmed? So what do you think? So it starts off because France, due to global warming, deforestation, there's like the longevity, the mosquitoes, they live quite longer. and they have expanded their distribution. So you can find Asian tiger mosquitoes in France now, southern parts of France, even Paris. So these Asian tiger mosquitoes not only transmit dengue, but they can transmit Zika and chikungunya as well. And when you have a Frenchman, sorry, thank you. When you have a Frenchman visiting endemic area like Thailand and get bitten by mosquitoes, they tend on to developing symptoms. Like majority of them don't have symptoms, right? They can be subclinical symptoms. But 30% of them actually require hospitalization because they have sort of symptoms. But anyways, when these travelers return back to their home country, like France, so they're infected traveler and they're carrying the virus, and they encounter the mosquito in France, which feeds on them, and then they initiate the transmission cycle leading to clusters. So this is Bangkok after COVID. This is the airport, so it's very crowded. This is outside Bangkok in Chinatown. It's very crowded. So the problem here is like all these travelers from non-endemic area, they're naive to dengue, so they don't have any protection against dengue virus. So they come to Thailand, places like Thailand, and you see this is Pattaya Mail. They were saying that they're expecting at the end of this year 40 million travelers to visit Thailand. So that's a lot of travelers. And next 5 years, they're expecting 100 million travelers visiting Thailand. So that's bringing in a lot of naive individuals without any protection against the tropical diseases. So they would come here, spend some time here, get infected, and will be traveling back to their home countries, carrying the viruses with them. So that's a big problem. So this is what we, over here, we see the outbreaks over the years. So in Thailand, dengue has like a periodic outbreak. So every 4 years, there's a large outbreak. So in 2013, we see we are seeing an additional peak on 2013 and 2015. So there is a trend here. If you see, there's a trend almost every 4 years. But this is from the Zika outbreak in 2013. So that's the additional line there. Okay, so last year there was like 120 cases in 100,000 people population. That's a lot of dengue cases. That's actually the largest outbreak ever recorded in the past 2 decades in Thailand. Okay, so let's go back to our topic. So how did dengue get its name? So the origin, what we know that in Swahili it means karinga pepo, which translates into what does it say? Cramp-like seizures caused by evil spirit. So probably I think this is the end of the spectrum of the disease, where the patients are very sick, bleeding from all their orifices. That's why they think that it's like a karinga pepo from the evil spirit. But in India, they call it dinga, which means twisted. So there's some association. But the real name, like dengue, it comes from a Spanish queen. She got dengue, and then she wrote in a letter that I had dengue, I was struck down with dengue. But the disease actually, the virus was actually isolated in Asia and in America, but the mosquitoes, they were actually found in the tropical islands like the Maldives, Indian Ocean islands, where there's a lot of mosquitoes. And during the 17th century, that's when the mosquitoes got distributed. So you already know this, like from Europe to Africa, they brought in the weapons, and from Africa to America, that's the slave trade. From America to Europe, that's the sugar trade. So that's during the 17th century where dengue had spread across the world. But the earliest record of dengue is actually written in Chinese literature. Back then, the emperors, they were the physicians, so they kind of had a knowledge of what causes dengue. So they had these bed nets, right? So that's an emperor's bed, and they called it water poisoning associated with flying insects. And then to what we know in literature, Benjamin Rush, a physician and a politician, American, he actually termed the word breakbone fever. in my opinion, breakbone fever might be just chikungunya, which is another viral infection which causes joint pains more than dengue. But anyways, in 1780, Benjamin Rush went, he went around houses and then he plotted this map of Philadelphia where the outbreak occurred. So I'm sorry about this, the size of the text, but I wanted to show you that we've known dengue since 1780. And over here, it's like what they believe to be dengue, but it's actually chikungunya. So as early as 1779 in Indonesia, they've actually described it. Okay, so dengue hemorrhagic fever and dengue fever was more, we started knowing about it, the hemorrhagic manifestation in Philippines and in Thailand in 1965 when outbreaks occurred. So back then it was just 1 or 2 serotypes. It has 4 serotypes. But if you look at over the time, this is the present day, and it's kind of spread across the whole of tropical zone, including a lot in South America. So I always ask about, when my Japanese students visit our hospital, I always show them this picture and ask them, like, do you know this guy? So they really don't know anything about him. But this is Professor Susumu Hotta. He's the first Japanese physician to isolate the dengue virus from an infected soldier. And at the same time, Professor Sabin also isolated the dengue virus in Hawaii, also in a soldier. So they both isolated the dengue virus at the same time. So the vector is the Aedes aegypti and Aedes albopictus, which is, we know it as the Asian tiger mosquito. So from this slide, I want to point out the illustration over here. So you see a hand and a mosquito biting the hand. And it looks like a patient is in the hospital because there's an IV line, right? So the question is, like, can the mosquito be transmitting now after biting the patient? So what we call this is mechanical transmission. So that's just like a needle prick injury when you're at the hospital and the nurse suddenly accidentally pricks herself. So that's a needle stick injury. So the same mechanism can be applied for the mosquitoes. So the virus might remain in the proboscis, and it might be going on feeding on multiple people, so that can also transmit the dengue virus. But in med school, they always taught us about this, that within the mosquitoes, the virus needs to be amplified inside the mosquito's gut before it can be transmitted. But now we know that, okay, mechanical transmission is also at play, especially when there's a lot of people with no immunity against dengue virus. So that also might be a driving factor of large outbreaks. Over here, we see two different mosquito species, and they're like widely distributed now in a subtropical region. So the virus, it's a flavivirus, like a yellow fever virus. The prototype flavivirus, Zika virus, is another flavivirus. So these round viruses, which has like several structural proteins, which have various functions, some gaining entry, some causing more severity. And this is the trajectory. So remember I told you about the professor in Japan, right? So this is what they did back in the day. So they get a volunteer and they inject the dengue virus to actually know what happens, right? Right now, this is not allowed. We need to have certain ethical approvals, but back in the day, that's what they did. So actually, there's like, so what happens is like a volunteer, so he injected the virus, and then over here we see the temperature, and we see the symptoms and signs. So I'm sorry, so you see the fever peaking a few days after the onset. So the first signs and symptoms are like malaise and anorexia, something like that. But then you move on, you have fever, you have joint pain, you have fatigue, you have hemorrhage, right? So you have hemorrhage as well, and some rash. So the story behind this was that during the war, his lab got bombed, right? So there's no animals, rodents to maintain the virus. So he had to like ask for volunteers to like inoculate to keep the virus, to have the virus be able to passage it. So that's the story behind it. And then we have the classifications, right? As time went by, we learned more about dengue. It not only causes fever, and it not only causes like asymptomatic, but it doesn't cause symptoms. But those in the large proportion, it doesn't cause symptoms. But in those which the symptoms are manifested, they have hemorrhagic manifestations, or they have organ involvement, which can lead to severity. So these classifications were described, but we were having trouble, clinicians were having trouble like classifying these into the groups. So they came up with another classification in 2009. So now they call it, they term it all as severe dengue. So if you have, and they provided some warning signs. So if you have dengue and you go to the doctor and they test you for dengue and say you've got dengue, so just watch out for warning signs. So that's what you need to look for. So you need to see if you have abdominal pain, if it's persistent abdominal pain, right? Or if you have like vomiting and it's like multiple times of vomiting. Or if you have any bleeding from your gums, these are the signs which you should return back to the hospital and then have looked up by a clinician. So this is the clinical trajectory of dengue. So this shaded area where it says shock and bleeding, that's the time where we need to really intervene and give you some IV fluids to maintain your blood pressure. And after that, if you're okay, if you pass this critical phase, then you'll recover well. And okay, so the Hospital for Tropical Disease where I work. This is my wife and my daughter when we first arrived here 10 years ago. The hospital also provides a residency training program. It's just started 10 years ago, and for 3 years we trained Thai doctors to become travel medicine specialists. And we have a lot of collaborators where we're able to provide services like diagnostic services. Okay, so this is one landmark study done at the hospital. So back in 2015, so they recruited we have a fever clinic. We don't have an ER. So at the fever clinic, we recruited like 4,000 cases of patients coming in with fever. From that, we excluded malaria, right? And then we were left with 397 cases. Well, from 397 cases, majority were dengue. So 40%, almost 40% were dengue. And then there were like other diseases like what I mentioned earlier, like the rickettsiosis, right? So bacterial rickettsia, leptospirosis, a bacteria, scrub typhus, a bacteria, and some other viral infections. But the point, the important part is like dengue is the majority of infection. So this is the clinical This is the clinical spectrum of dengue based on the classification. So what I've highlighted here is the dengue-associated vascular permeability. So this is the severe form of dengue infection. So what happens is like the proteinous fluid inside within your blood, it leaks out. And then, so 38% of this whole group were classified as they had leakage syndrome. And then if you notice here, there's like the 4 serotypes, right? Dengue has 4 serotypes, 1, 2, 3, 4. Certain serotype predominates at different years. And some say that some certain serotypes are more severe, like dengue 2. Retrospectively, when we look at it, it seems to be more severe than the other forms. But in our experience, the severe form is actually the one serotype which predominates during outbreaks. So if it's for example, if it's serotype 4, which predominated during this period of study, we saw more cases of serotype 4 having severe symptoms. Okay, moving forward. So this is what I mean by dengue-associated permeability syndrome. So this is inside your blood vessel. So these are structures keeping the integrity of the blood cell wall. But when you have dengue, these proteins leak out. So it doesn't maintain the blood pressure. That's why you go into shock. That's why we need to intervene and give some IV fluid to maintain the blood pressure. So once that happens, the blood becomes thick. So it's called hemoconcentration. So it becomes thick, and there's lack of oxygen. So during the shock period, this is what happens, right? During this period, that's when the leakage happens. That's what we are worried about. So just recap of the warning signs. When your body temperature, when you recover, well, when in dengue you have fever and the fever subsides, that's what we call defervescence. So when your fever subsides, that's when you enter the critical period. So during that period, you need to watch out for these warning signs. And these are the warning signs which we observed in our cohort of 100 cases, like their liver, they had a larger liver, they had bleeding from their gums, right? They had abdominal pain, and some of the blood products like platelets started decreasing. So these are the warning signs which we observed in our study. And these are the signs which we observed. So majority of them had headache. Retroorbital pain means like you have a sensation of ache behind the eye when you look sideways. So retroorbital pain, that's classically described with dengue. The body aches, joint pains, loss of appetite, right? So that's one symptom of dengue, like your morning coffee won't be tasting like coffee anymore. And nausea, vomiting, you're unable to eat, unable to drink, which leads to dehydration. There's a bit of diarrhea in dengue, but not a lot. The volumes are less, and rash is a big thing, right? So I'll show several pictures of rash. And bleeding is the other manifestation. So when you have a fever and rash, simultaneously you must think of, okay, this is an arbovirus. So which means like it's a virus which is transmitted by the mosquito. So it could be dengue, it could be Zika, it could be chikungunya. So just watch out for fever and rash. So here we've actually classified them into the group which has the leakage, identified as DHF, dengue hemorrhagic fever, and the group without the leakage. There seems to be some differences, like individuals with DHF, they had to remain in hospital a bit longer than those with dengue fever. Maybe headache is more common in DHF, like all 37 had headache. And things like bleeding might be common in dengue hemorrhagic fever, like it's 54%. So these are the signs and symptoms between two. So this is the dengue rash. It's called the convalescent rash. What you see here is the trunk of infected patient, and it's erythematous, which means it's red. There's a rash. And the white, the areas with the normal skin, so it's got areas with normal skin surrounded by red rash. So that's called the convalescent rash. But the drawback with this is like, well, if you're working in a travel clinic and seeing returning travelers from Thailand, then it's great because you can tell your client, this is dengue, you don't have to do any more tests, because we see it when you recover. So that's the drawback. If it erupted very early, then we could tell that this is dengue. So this rash appears much later. But the other rashes, like the febrile rash, so this is the type of rash you'll get on the first day of dengue. So you have flushing. So you have to touch the body, and then you see blanching. So if you see blanching, then which means like, okay, this must be dengue. So in this case, he actually presented to the fever clinic within 12 hours of fever. He had fever in the morning, he came in the afternoon to our fever clinic. So the problem we face is when they come too early, our diagnostic kits, they don't work so well. So when we run the tests, it was all negative. But clinically, we know it's dengue because of the rash. So that's the drawback we have with the available test kits. This is an European, so you see, like you don't really see the rash. It's like she's got a tan. Seems like she's got a tan, but when you really touch, there's the blanching. So you see the blanching rash. Yeah, so these are the other types of rash you see over the course. Like this is a classic presentation. It's called a clustering petechia on extensor surfaces. So you see the petechia, like bleeding into the skin surfaces. The next picture is the convalescent rash. You see the red rash with the white normal skin, and it can be very, very, very erythematous. So dengue has a lot of skin manifestations. The other manifestation I was telling you about is the bleeding, right? So in our experience, like maybe you might all be thinking like dengue, if you get dengue, you bleed out and you die. But the bleeding is really mild. So these are the major bleedings we see. Mucosal bleedings, like when you brush your teeth, you might have some bleeding gums. You might have women, when they have dengue, they have their menses, and the bleeding might be more. And you might be bleeding from your nose, you might have bleeding blood in your stool, and you might have hemolysis, which means like this. This is not coke. This is the urine, and there's like red blood cells hemolyzed, which means the red blood cells have lysed. They've been destructed. So your urine might turn this color. So if it turns darker, please seek medical advice. So if this happens because of hemoglobinopathies, which means like your red cells, they have some abnormality, right? So that's common in Asia. And another word is favism. So fava beans, like what you see in 7-Eleven, if you eat fava beans, you might have hemolysis, right? Or so if you have this enzyme deficiency, that you're prone to this bleeding. So how do we diagnose dengue? WHO and a lot of authorities, they tell us, or they tell resource-limited doctors working in resource-limited settings to perform this. So this is called the tourniquet test, where you take a normal, the blood pressure cuff, right? So you inflate it and leave it on for like 5 minutes. So it's really uncomfortable. I've tried it with several of my cases, and they really don't like it. So once you leave it on for like, with pressure for like 5 minutes, you see the petechia appears. So you make that appear. So, but we advise not to do that anymore. But theoretically, how we diagnose dengue is we can culture it in cells, like it's called virus isolation. We can do plaque reduction assay, and we can do PCR. But we have now rapid diagnostic test kits like the COVID test or the pregnancy test. But the thing is, like the test kits, like for dengue, they can be falsely positive when you have JE, which is Japanese encephalitis virus, or Zika virus. These are all flaviviruses. The viruses, they belong to the same group. So they can falsely cross-react and falsely make the test positive. So we need to watch out for it. So, so this is what I'm trying to do. So this is a Japanese invention. It's called multiplexing, which means with one specimen we can test for several pathogens. So we don't have to use single test for single disease. We can use one test for several pathogens. So we're going to bring it to the hospital, and then we're going to do it. We're going to see how well it performs, so that we can put it into service. So that's some innovation what we are trying to work on with, which might lead to a real-world impact. Okay, coming back to dengue, we had a group of travelers visiting Bangkok, I think in 2017. So they all came to learn Muay Thai, right? And then they all got struck by dengue. So 12 individuals, we think they have primary dengue infection, all confirmed with a laboratory test. 4 developed warning signs like abdominal pain, vomiting, and so like 75% required hospitalization, remaining 25% was managed on an outpatient basis. But they all had to cut short their training trip, and return back to their home country. And within a period of 3 weeks, all 12 of them had dengue. So this is the timeline showing their arrival to Thailand, and the red dot indicates when they were diagnosed with dengue. So unfortunately, they all had dengue. And interestingly, we sequenced the virus, and we run it, and then we found out that it was the same virus, which infected all 12 of them. So that was a cluster. Moreover, we have a popular program called the Diploma in Tropical Medicine and Hygiene, where we have annually like a lot of European students, doctors, doctors from North America, visiting us to learn about tropical diseases, right? So last year, the group of students, one of them identified them, called me up and said, look, doc, I've got a fever and a rash, and I just came back from a field trip. And I was like, okay, let's have a look. And he was positive for Zika. And then we went back and traced the whole group. We checked this, the serostatus, which means like if they have dengue, Zika or not, if they had antibodies or not against Zika. And within so the duration of the course is 5 months. So within 5 months, we found out that 25% was infected with Zika virus. And one remained symptomatic while the other one was asymptomatic. So the attack rate was like 12.5%. So compared to dengue, the Zika is not so aggressive. Well, dengue, like it's 100%. So this is your study. I think I recognize some familiar faces. This is all your participation, like before COVID. We came out here, we asked for your participation, and you gave us very generously 5 ml of blood. We performed venipuncture here, we collected blood. So what we found out was like expatriates in Pattaya, when you spend 1 year, cumulatively 1 year, at the end of 1 year, 30% of you had dengue. Yeah, 30% of you had dengue. So let's look into the study. So this was done in 2017, and yeah, so we excluded some who had received their JE vaccines, or tick-borne encephalitis vaccine, or yellow fever vaccine. And so the total number of participants was like 254. Majority were male, median age was 65, with a range of 51 to 72 years old. 30% you've had underlying comorbidities like diabetes, maybe, hypertension. And then that's the demographics. 64% were from Europeans, 18% from North America, 15% from Australia, New Zealand, and 70% lived in condos. That's great. And the rest lived in urban areas, like in houses. So these are the activities which were reported, right? So the activities included trekking, gardening, fishing, and the time they spent outdoors was like 8 a.m. to 5 p.m. So majority spent time outdoors. So factors associated with getting dengue, right? So when we did some stats, we found out that when you did activities from 5 a.m. to 8 a.m., the odds of getting dengue were higher. So what do you do during 5 a.m. to 8 a.m.? Go for strolls, I don't know, gardening. So, but interestingly, the risk decreased when you spend time in the evenings. 8 p.m. to 5 a.m., the risk of getting dengue is low compared to the morning. So this is behavioral. I don't know, we have to do more studies to understand what were the activities. So in one way, it's good to know this. And then it's very good that majority of you actually used insecticides, right? So what was the result? So 30% had dengue. Japanese encephalitis, 20% had JE, and some had Zika. But 40% had no infection, so you did very well with your DEET, applying insecticides, staying indoors, avoiding exposure to mosquitoes, so you did a good job. 40% of you, within 1 year, had no infections, no dengue, no Zika, no JE. So how do we prevent? So in France, they could have done this, right? They could have put out signs, use insecticides, stayed indoors, and use mosquito nets, or protect yourself from mosquito bites, which could reduce exposure and eventually decrease the disease. And we recommend it, and it's more or less effective. On the other hand, we have vaccines. We have 2 new vaccines which for against dengue. So one was, the problem here is like the recommendation in Thailand is still not so clear because the evidence is not there. So dengue vaccine was the first vaccine introduced in 2015. It's produced by Sanofi Pasteur, includes 3 doses, and what they found out was like if you are naive to dengue, you cannot get it. we should only receive dengue vaccine if you've had prior dengue infection. So you need to show up with a positive result, and then you can get this vaccine. And it consists of 3 doses. It's a good vaccine. It prevents hospitalization. It prevents dengue. It's good. 3 doses. But I think the company is now going to not discontinue production of this vaccine. So it's still available in Thailand. So that's what the US CDC recommends. Like you need to be, you have to test before getting this vaccine. The new vaccine is called Q-Dengue. It's by Takeda. And some trials they've studied, so they conducted several studies in South America and Asia among children, right? Not adults. But they found out that this vaccine also is quite effective, like reduces hospitalization by 80% and reduces dengue by 60%. And it's only 2 doses. However, the experts, not me, different experts, global experts, they recommend this. In high dengue burden settings, right? So which means like when you collect blood and we test for dengue, the 60% should be positive. So that's considered high burden. But WHO, they have a higher, the threshold is a bit lower. So they say it's 80%. So what's the serostatus in Thailand? So this is done in Bangkok among Thai local people, not foreigners. So we found out that, okay, at the age of 9 years, 6 to 9 years, it's 46%. But it's very high when in adults over 20. It's almost 80%. So it's high burden endemic area, Thailand. So should you get the vaccine? Should you not get the vaccine? For now, the Travel Clinic has a policy that we do not recommend the vaccine because there is not enough data. The existing data is only done for over 4.5 years, and among children, it's not. It doesn't include people, adults. It doesn't include individuals over the age of 60. So we don't know. We don't know how many doses you might require, how long the effectivity is. So we still have to wait. So for now, the standpoint is we do not recommend. Although in Europe, it's a travel-related vaccine. So if you're in Europe and if you go to Travel Clinic and you tell them I'm going to Thailand, they'll like, oh, you need to get the dengue vaccine. So in Europe, they're going to offer it to anyone above the age of 4. But in Thailand, we have a restriction. I think it's allowed from 4 years to until 60, not above 60. Okay, I think I rushed through it a little bit. So please visit the Travel Clinic. There's a traveler's blog, and there's important questions answered here. And we have teleconferencing. So if you have any more questions, please reach out to us, and we'll be able to explain it. It's just like we won't be able to give a blanket recommendation like everybody needs dengue. It should be individual basis, right? So malaria, coming to the other diseases, malaria. So we all know that malaria has been around for a long time. It's one of the oldest diseases, I think, except syphilis and TB maybe. What in Thailand, you don't have, well, the CDC travelers book advises travelers coming to Thailand and visiting these red areas to take malaria prophylaxis. But we do not recommend that. So if you explore into the forested area and you return back and develop a fever, please visit a hospital, because we would test for malaria and we would see it under the microscope. And if it's positive only, we would treat it. So you don't have to take any prophylaxis. What's important is, like, as the world goes towards malaria eradication by 2030, I think recently, this week, Egypt was declared malaria-free with everything going around. So, but in Thailand, they have a problem because it's landlocked. So there's Myanmar, there's Cambodia, there's Laos, where it's also malaria is endemic. So malaria is still around the borders. But interestingly, as we move towards eradication of human malaria, we are seeing more of monkey malaria. So it's called Nolsai, Plasmodium nolsai. If you go to the forested area, you see long-tailed macaque monkeys or screw-tailed macaque. These are natural reservoirs where the parasites are. So mosquitoes biting the monkeys and unfortunately biting an individual human, that initiates the transmission. So it's easy to, well, the thing is like when you go to the doctor, they would say that it's malaria, but they would not be able to tell you that this is Nolsai, right? Because we need sophisticated testing to identify the species. We cannot distinguish it from other species based on microscopy. So Nolsai malaria, that's something you should think of. And while you're in Thailand and you visit, you venture into the forested area, and then return back, and if you have fever, please go to the doctor and tell them that you've actually been to the forest. This might be malaria. Why don't you check it? Okay, so chikungunya, this virus. I think you've all heard of chikungunya. Anyone had chikungunya here? No, good. So don't have it because it's not like, unlike dengue, it's got a chronic cause. It's not a flavivirus, so the test kits won't cross-react. So it causes debilitating arthralgia, which means like joint pain. You're unable to button up your shirt. You won't be able to like open doors, use a pen to write. So it's a big problem. And I'll tell you about some cases like, so this is post-chikungunya virus infection musculoskeletal syndrome sequelae. So what happens is, this is in our observation. So a patient visited us in October of 2019. She had fever, high-grade fever. She had like arthralgias, a pain score of 8 out of 10. She had her large joints were affected, small joints were affected. She had a rash, which was itchy, and she had conjunctivitis. So the doctor there worked up for all these diseases which are transmitted by mosquitoes, and eventually we got chikungunya positive. So we treated the patient, and she returns back the next day. She's much better. So an entire year goes by, and exactly on October 6th, she returns back. Now she knows where to go, right? So she comes back to us again with similar symptoms. So on the second visit, a year later, she had fever, she had joint pains affecting the small joints, and we did the workup. Chikungunya is negative, right? Dengue is negative, nothing is positive. But what we found out was like the antibody response is declining. So once the antibody response is declining, the symptoms are coming up. So she's having relapse of her arthralgia and musculoskeletal symptoms a year later. So this is what chikungunya does. You get the infection, but there's sequelae. You have the symptoms persisting for years, right? 60% of the cases. Okay, so this is what she presented with. So you can see her index finger. You see where the ring is. It's like kind of swollen. So this is when we treated her. She returns back with no symptoms. So be careful of chikungunya because it's not just an acute infection, it's a chronic infection. Okay, and we are very proud of this because the chikungunya diagnostics, like the COVID test, it doesn't exist commercially. So we had our collaborators at Mahidol Osaka Infectious Disease, our collaborators, they developed this kit. It's a new prototype. It was so novel that it got published as the cover story in this journal. So we're kind of proud of it. And coming to rickettsiosis. Okay, so rickettsia is a gram-negative bacteria. It was thought to be a virus because it's so small and it resides in your cells. So it's intracellular. So that's why it can evade detection. So in Thailand, we have scrub typhus, which means, well, scrubs, like you have to expose yourself into forested vegetation, and mites bite you and transmits this bacteria. Whereas murine typhus, you don't need to be exposed into the forested area. This occurs in urban settings where there's rodents. So if you come into contact with a rodent, you accidentally step on it, the flea on the rodent jumps onto you, takes a blood meal and defecates, and then we scratch and inoculate the bacteria ourselves. So that gives us murine typhus, right? So it's just there's just a fever with a bad headache and some rash. The thing is, like, doctors, they don't really know about this. So it goes undetected, untreated, until it becomes severe, right? So something you should be on the lookout for, murine typhus in Pattaya. So next is a case. 8-year-old boy, last year, American Thai boy. His grandfather visited him here in Thailand and took him to a national park, Krangkachan National Park. Then they did some hiking, right? So they had a good time. But then he returns back to a fever clinic with a history of fever for 3 days and chills and headache, loss of appetite, some symptoms like dengue. But what we found out was, like, the mite actually had bitten on his scalp, and it caused an eschar, which looks like a scab. It looks awful, but it's painless, so you hardly notice it's there. So this is the time course of how long it took for the eschar to fall off, and then we had to treat him with antibiotics. So if we had not seen this, we would not given the antibiotic, and he would have all the time worsen, and maybe end up with complications. So if you go to a forested area, come back, and if you have a fever, just search your body for, like, some wound which doesn't hurt. Usually it's found in areas hidden, right? So what happens is the mite jumps onto you, and it travels up. And then once it sees a barrier, that's where it feeds. So it's usually in the around the brassiere line or the panty line. So you need to really expose the patient. I mean, you expose yourself and look for these unusual lesions. It's called the eschar. Well, it looks like a cigarette burn, right? Okay, leptospirosis is another bacteria. It's a spirochete, like the syphilis. So spirochete. And this bacteria resides in the kidneys of the rodents, right? And when the rodents urinate, the bacteria is spread to the environment. And when you have flash flooding, like raining in Pattaya every day, flash flooding, and you get exposed to it, if you have injuries in your foot, then the bacteria can get inside yourself and then cause problems. So there's another case, a German man who lives in Bangkok for some time. He had fever. When he presented to us, he had fever, he had headache, he had muscle aches, he had loss of appetite. Well, just non-specific symptoms, puzzling for us. But he told us that he went to Khao Yai National Park, and he did some activities like kayaking and freshwater rafting. So the initial day when we did the examination, we couldn't find anything, so they didn't suspect of anything. So they gave him some supportive care and sent him off. But then on the follow-up day 4 of illness, his symptoms got really worse. So we had to admit him, and he had some complications. So don't do this, okay? Don't do this, and don't do this. Right? Don't get yourself exposed to flash flooding, because that's going to put you at risk of developing leptospirosis as well as melioidosis. So melioidosis, do you remember the last disease I told you, which the bacteria found in the soil? So now Thailand is facing a lot of flooding, right? So the flooding is pushing the bacteria. I mean, it's spreading the bacteria everywhere, right? It's spreading the bacteria into people's, flooding causes water coming into your houses. So the bacteria also invades your home. So be careful with exposing yourself in flash flooding, because it's not only leptospirosis, you'll get melioidosis as well. So it's caused by a bacteria called Burkholderia pseudomallei. In horses, it's called glanders. So horses also gets this. And there are some, the manifestations are like overt blown bacteremia, like bacteria in your blood, and you have like really bad time and go into shock. Or the other manifestation is you present with abscesses, like you can have pneumonia or you can have abscesses in your liver, in your spleen. So when you have a prolonged fever, like fever for a week or longer, and you have exposure to like those flash flooding or have visited northeastern part of Thailand, Ubon Ratchathani, then you might want to mention this to your doctor so that they can optimize your antibiotic treatment, right? Okay, I think this is my last slide. I think we have enough time for questions. Thank you for your attention. Monkeypox.
About what percent of the local Thais get dengue and don't even know it?
Yeah. So if you, I'll just go back to my slide. Thais age above 20 years, 80% of them have dengue already. When they're 20 years old and older, 80% of them would have dengue.
And they have no fevers?
Well, the majority of them have no clinical symptoms. Yeah. So it's just like when we randomly test your blood, and then we find out that okay, a majority of them have already had dengue.
Yeah, because first time you get dengue, this is what Dr. Baraklov said, first time you get dengue, often you think you've got the flu, but you don't have a productive cough like I do, or sneezing and runny nose. It's when you get bitten by a second strain of dengue fever mosquito, is that the big problem?
Yeah, so from our understanding, dengue has 4 serotypes, so you can have infection 4 times in your life, or even more. So the first infection is usually mild. It's called the primary infection, but that's often occurs in your childhood, right? But when you're an adult and you have primary infection, like the cluster of I showed you of the Muay Thai people, they were all adults, and that was their first time having dengue. But majority of them had symptoms. So primary infection in adults, they still have symptoms, right? But it might be mild. So once you have a dengue infection in your lifetime and you're unfortunate to have a second infection, that causes what we call antibody-dependent enhancement. So your existing immunity works against you. So the second time you get dengue, it's considered more severe because of this phenomenon, right? Phenomenon. Your antibodies, existing immunity works against you. But there's more evidence now that that might not be the case. So dengue, as what we know, is a childhood disease, but now there's an age shift. So adults are getting more dengue and elderlies are getting more dengue. So in the adult and elderly group, when they have dengue, they have leakage. So we don't know if this is due to subsequent infections or their underlying conditions like diabetes. So this is new area, and there's more evidence coming out that if you are diabetic, chances of you having severe course of dengue infection is more likely than an adult without diabetes.
Hey, Doc, very comprehensive problem for all of us. I'm thinking of moving to Iceland. Now, joking aside, it is a problem that any one of us can pick up without knowing about it. And it can, in some cases, at our age, my age, be a killer, as you well know. The other question I have to ask you, didn't they virtually eradicate mosquitoes in the late 40s with DDT? And was it not a scientist who turned around and said, no, you can't use DDT because it can affect humans? Is that correct?
I'm not. I don't have an answer for that, but I think they didn't eradicate the entire mosquito population. They did that. They did very well control in places like Cuba, where mosquito control was very effective. That dengue was not seen for like a decade or two. But so DET, I don't think it causes problems in humans.
I have a natural immunity to mosquito bites. I don't get any redness, swelling, itchiness, or anything like that. Would that make me more resistant to these diseases?
So the rash in after you get bitten by mosquitoes, that's coming from different species of mosquitoes. So it might not be the Aedes Asian tiger. It might be a different species of mosquito which bites you and then gives you a rash. But I don't think we are in any way resistant to mosquito bites. Yes, go ahead.
My brother-in-law was in the Food and Drug Administration, and he said they pretty much just simply put oil on top of the water and stop the mosquitoes from reproducing. Any kind of oil would work.
Yeah. So the way to control dengue is like controlling having good vector control. So we could either put oil or we could just get rid of the standing water. So just empty. Yeah.
So I understand that people who live in houses tend to be more vulnerable to people in condos. Is that because of the standing water issue around houses is more widespread?
Yes. Yeah. The Asian tiger, it's like a anthrophilic, which means they love humans. So they live around us. And they can fly 100 meters from human habitat. So living in condos, we have proper windows and it's shut most of the time because of the air conditioning, whereas in houses you might have neighbors and a lot of areas where there's more breeding spaces. As you can see, I think in our study, there was individuals from living in an urban area had more dengue than people living in the rural area. So it doesn't really. You can't really say that I live in a condo and I'm mosquito bite free, but it's just have to have that precaution wherever you live, especially going out, not wearing shorts. If you do wear shorts, just put on some insect repellent, or maybe just use long pants like the what is that, the linen elephant pants.
Yes, I recently was in the United States and I was asking about vaccinations, and dengue came up, and they said, well, have you had dengue before? If you had it before, we can give it to you. If you haven't, you may get sick, and it was only one shot. It wasn't a panel of 3. Could you tell me a little more about that?
Do you know the name of the vaccine?
I can't recall.
Do you have a vaccine booklet?
I can't recall. She didn't. She mentioned that I shouldn't have to have it because I haven't had dengue before.
Yeah.
She said I could have side effects taking it without.
So when was this? Like recently?
Yeah, just about 2 months ago.
So as you've all seen, the 2 dengue vaccines, this not only a single shot. So the first one has 3 doses to complete a course to have full protection, and the new one has 2 doses. So a single dose dengue vaccine, I think there's something wrong about it.
Are mosquitoes more prone to stay close to the ground and therefore less likely to penetrate the upper floors of high-rise buildings, or is there no truth to this?
Mosquitoes don't thrive at elevations like 1,500 meters. So if you go hiking to altitude, you don't find mosquitoes. But if you live in a condo, you still find mosquitoes because the residents below you or living above you might have something which can collect water, and mosquitoes can breed in the balcony, like pots and stuff. So even if you live in a high-rise tower, you still find mosquitoes because they can live a floor below you or a floor above you. But at altitudes, like if you go to Kilimanjaro or Mount Everest, there's no mosquito there.
Is it true if you live by yourself, you might be slightly less vulnerable, because don't they tend to bite someone who's already got the virus, then fly over to you and give it to you?
What was the question?
Well, if you live by yourself, totally
live by
alone,
yourself.
versus living with 4 people, for instance, who may have already, had it.
Yeah. So the reason why we think like the primary infection is it doesn't have any symptoms is they're asymptomatic is because the viremia, the virus load in your body is not that high to produce symptoms, right? So you only produce symptoms when the viral load is at a certain level and your body starts fighting against it. So to answer your question, if you live with a group of people and say they have asymptomatic dengue, there's less chances of them transmitting it. But if you recall the illustration I showed you, the red hand with the mosquito bite with IV, so that means he's very red, right? Which means he's got a very high burden of viruses in him with the rash. So if a mosquito bites him, there's more chances of the virus to be spreading by subsequent feeding. Yes, please.
Yeah, I don't seem to be bothered by mosquitoes too much. Could it be because of Scotch whiskey?
It might be.
He's only bothered.
Irish mosquito.
It's the mosquitoes that are bothered by him. They get drunk and they can't fly. Before I... oh no, I'll do this first. Firstly, thank you for the education you gave us today. It was amazing. Huge round of applause. So, who was here? Who got tested when he was here about 4 years ago? They were giving away presents and stuff when you got tested. You might have been tested and not remember.
I think yeah. Andy Barklov, yeah, I should mention him in the acknowledgement. He was the one actually who introduced me to Pattaya City Expat Club, and we owe him a big deal. A lot. It's because of him that the whole study went through. So
stand
thank you, Andy.
up, Dr. Andy. Come on, stand up. Round of applause for Dr. Andy, who's given some wonderful, wonderful talks at the club. Thank you for what you've done. Yeah, I was there when the day when he gave his first talk at the club. It was on dengue, and he said, "Okay, it's about 100 people." It was on a Sunday, and he said, "Who here has had dengue?" 7 people put their hands up. Jaws dropped, and then he said, "Oh, there's about 100 of you in the club. About 50 of you have had dengue fever and don't know it." Everybody went, and after that, you could have heard a pin drop. And one guy said to me, I was in fear the whole time during the talk. Seriously. All right, well, but huge thanks for such an amazingly comprehensive talk. Wow, wonderful PowerPoint too. And I can't recommend the Travel Clinic too highly. It's actually quite easy to get to. It's near Victoria Monument, and it's just a walking distance from there. The vaccines are like non-commercial prices because it's attached to a university. So you want to get it. When my partner Rose had never had a vaccine in her life growing up in rural Myanmar, so we took her to there and they gave her all the vaccines, etc. It was amazingly good value. So really, and in fact, after the first one, Dr. Andy Baraklov's talk, we organised a minibus to take a group of us up there to the Mahidol's Travel Clinic, and we all got vaccinated with various things. You didn't mention Japanese encephalitis.
No, I didn't. Yeah.
Quickly.
Yeah, in the study, right, it was like 18% of you had exposure to Japanese encephalitis virus. So this is a virus which amplifies in piglets. So if you travel to rural Thailand where they have pig farms and separate species of mosquito called Culex, then you might be at risk of getting JE. But the incidence is quite low. So it's like, I think 1 in 100,000. So for the incidence, when compared to dengue, dengue is far much more common than JE. But the consequence of JE might be far more dreaded, like you develop encephalitis, well, you develop some problems in your brain, and after you recover, there's some sequelae, so trouble concentrating, trouble reading, things like that. So when you're traveling to Thailand and you say like you're gonna spend significant time, like more than 4 weeks in Thailand, and current recommendation is like we would advise you to get your Japanese encephalitis virus vaccination. So yeah, it's there's several vaccines available, one's live and inactivated vaccines. So I think yeah, if you haven't got it and if you're planning to be placed in rural Thailand where there's pig farming, yeah, maybe it's worth to get JE vaccine.
Yes. Thank you again, Doctor. Thank you so much. Huge round of applause. Thank you.